All right, let's dive into a case that you are almost guaranteed to see in your UKMLA or PLAB 2 exams, allergic conjunctivitis. We're going to walk through a perfect consultation, step by step, from that first hello all the way to the crucial safety netting at the end.
Welcome to this clinical walkthrough on the allergic conjunctivitis case for UKMLA, brought to you by Mediate, your 24/7 practice partner. Seriously, by the time we're done here, you're going to feel so much more confident about hitting every single mark in this station.
So here's our game plan. We'll break it down into 5 key parts. First, setting the stage. Then, mastering the history. After that, getting the full picture. Next up, diagnosis and management. And we'll wrap up with that all-important safety netting.
All right, section 1, setting the stage. Look, those first 30 seconds, they are everything. This is where you build that initial connection, and even more importantly, lock down patient safety right from the get-go. So you walk in and you start with something warm and professional, exactly like this. It's so simple, right? But it immediately starts building that trust and confirms you've got the right person in front of you. And then, this next part is a total must-do. It is a critical safety check. Right after your introduction, you have to ask for their full name and date of birth. No exceptions. You don't move on until you've done this. Okay, moving on to section 2, mastering the history. Now, to make sure you don't miss anything and to keep your consultation on track, you need a good framework. Let's talk about the best one for this job.
And that framework is ODPERA. This is your secret weapon for exploring any presenting complaint. It stands for onset, duration, progression, aggravating and relieving factors, and associated symptoms. Using this means you'll never forget a key question.
So let's start with O for onset. You'll ask something straightforward like, when exactly did it start? And for this case, your patient, Hans, is going to say it started about 3 days ago. Next up, D for duration. You're trying to figure out the pattern here. So you ask, is it continuous or does it come and go? In this scenario, he'll tell you it comes and goes. That's a great clue.
Then we have P for progression. Is it getting worse, better, staying the same? You'll ask, do you think it has been increasing since it started? And his answer, that it stayed about the same, is super helpful for assessing severity.
All right, next is A for aggravating and relieving factors. What makes it flare up? What calms it down? You can just ask, is there anything that you think makes it better or worse? For this case, the patient hasn't really noticed any specific triggers. And now for the final A, associated symptoms. This is where you really start playing detective. You have to ask about these things to rule out other, more serious causes. Are we talking discharge, bleeding, or pain? Any fever? Any chance of an injury or something in the eye? What about a headache or problems with vision? In this case, he'll say yes to itching and watering, but no to all these other big ones. And this is exactly why those questions are so important. See? His answers help you narrow things down, the itching and watering points towards allergy. But because he said no to pus, you can start to think, probably not infective conjunctivitis. And with no severe pain or vision changes, you can breathe a little easier and push a scary, sight-threatening diagnosis like acute glaucoma way down your list. It's all pointing towards an allergic reaction.
Okay, let's get into section 3, the full picture. So we've explored the main complaint, but that's only one piece of the puzzle. Now we need to zoom out and look at the patient's overall medical background.
And honestly, this next question is probably one of the most high-yield questions of the entire consultation. It's simple, it's direct, and it's about to give you the biggest clue you need. And boom, there it is. Yes, doctor, I have hay fever. That's the golden ticket. This one piece of information connects all the dots. His itchy, watery eyes, it's almost certainly linked to his history of allergies. Now, it's one thing to know all these steps, but it's another thing to actually do it smoothly under pressure. So remember, you can practice this exact case right now and get objective feedback on mymediate.com. Right, let's head into section 4, diagnosis and management. You've done your detective work, you've gathered all the clues, now it's time to put it all together, explain what you think is going on, and create a solid plan for the patient. When you explain the diagnosis, keep it super simple, no complicated medical jargon. Something like this is perfect. It clearly names the condition and explains what it is in a way that connects directly back to what he's already told you about his hay fever. It just makes sense to him. Okay, your management plan should always start with some simple, practical advice. These are the easy wins, the do's and don'ts. Wash your hands, wash your pillowcases. Don't share towels, and please, try not to rub your eyes. This is basic stuff that makes a real difference.
Then you can lay out the full treatment plan using what I like to call the 3 pillars of management. It's easy to remember. First, do what you can to avoid the allergens. Second, get some simple relief for the symptoms. A cold flannel can feel amazing. And third, the actual treatment, prescribing some topical antihistamines. It's a really clear step-by-step plan that patients can easily follow.
And that brings us to our final and I'd argue most important section, safety netting. This is absolutely non-negotiable. This is where you give the patient the power to know when something is wrong and they need to get help fast.
You have to be crystal clear about these red flags. Tell them, look, if your vision gets worse, you need to seek help immediately. Same goes for any thick, pus-like discharge. That could be a bacterial infection. And if you get severe eye pain or a bad headache, that's an emergency. It could be something like acute glaucoma. You want them walking out of that room knowing exactly what to watch for.
And that's it. That's the complete walkthrough. You now have the entire framework to absolutely nail this OSCE station. But like I said, practice makes perfect. To put all of this into action and really smooth out your performance, you can practice this exact case now on mymediate.com.